But I want to welcome everyone today to this amazing session between ADP and Niara Consulting through my FOJ network. We decided to do this partnership with ADP because so many members of my network are small business owners, entrepreneurs, and or have a side hustle that maybe one day will turn into a full-fledged business. And it's good to know all the things you're going to need that you might not need today or might be in need today and looking for a better price, and how to really treat yourself well as an employee of your company getting paid and really help your employees feel that they are being included and have a place where they belong because you take care of them. Healthcare prices continue to rise. It is harder to find. They add new things. Every company offers some kind of massage service these days. The HSA and the FSA has skyrocketed to how much amount you can go into that not everyone's using it for band-aids, glasses, and contacts anymore. You can get a lot more bang for your buck. Someone like me loves the fact that they've added pet care, health care beyond just our humans. And a lot of folks have really been looking into FMLA, becoming caregivers and other things that you need, as well as childcare. And the list goes on. So I felt like this was a conversation I've had with so many people who, like myself, have gone in and out of different workplaces, and also have started businesses that are now large enough to have to take care of their employees in this space, but never really having a direct connection, of which I'm trying to give you today, to those who can actually help you through that process. And because it's Women's History Month, I had asked Walker specifically to find me some women, whether or not that was a hard task or not, she rose to the occasion. So beyond Walker, we have Kayla and Shannon with us today, who are our experts in this area. And we'd like to I'm going to hand this over to Walker, who's going to ask a couple of questions of you guys to get an idea of where you are at with this particular issue of healthcare, providing it for yourself, your employees, the costs, what you're thinking about when you think about healthcare. And we will then go through this presentation. Feel free to put any questions into the chat and or put a hand raise if you have a questions that you think you need answered before we move forward. And I might also jump in, Kayla and Shannon, if I feel like either I need something that needs to be, or I'm seeing something in the chat that should be addressed. So welcome everyone today, and we look forward to hearing our presentation. Walker?
Yes. Well, thank you all for being here today. I'm Walker McKnight, and I'm a small business consultant at ADP. And I might have seen some of you at our last event, at our last FOJ Business Power Hour, where we were talking about recruitment, retention, and retirement specifically. And I'm excited to be joined here today by my partners, Shannon and Kayla, to kind of dive into health insurance and how the landscape is changing and kind of navigating those changes. So would love to hear like what kind of brought you guys to join our conversation today, maybe some initial questions or thoughts that come to mind surrounding health insurance. So feel free to come off mute or put into the chat maybe some things that are coming to mind for you or some challenges that you've run into for offering health insurance to your employees at your business. So we can throw it into the chat, or also if thoughts come to mind as we continue presenting, we can.
I digress.
And just to kick things off, we're going to pass it over to Shannon, who's going to jump into health insurance kind of overall and what this looks like at ADP. So I'm going to pass it over to Shannon to take it away.
Thank you, Walker. Thanks, Jody, for coordinating this. Very excited to present today. So ADP has a few different ways that we support our clients when it comes to health insurance. I'll be speaking today about group health insurance, which is a traditional business group health insurance plan that's offered through the company. Different states have different requirements when it comes to how many participants are required, what type of contribution is required, and how the rates are set. I do sell mostly health insurance in New York. Tiffany and Lisa, are you based in New York? Just so I can gear it towards New York if that's helpful. If not, I can kind of speak more generally. If you just want to like throw in the chat.
And Tiffany's not in New York. She's outside of us in Texas and
Okay.
North Carolina.
Yep, in Texas, sorry.
Okay.
And this
All
is
right.
Lisa, and yes, I am based in New York.
Okay, so I'll touch on both. ADP has a subsidiary called ADP-IA, which stands for ADP Insurance Agency. That houses all of our group health insurance. And we've recently expanded into a different type of health insurance that is not a traditional group plan, which I'll kind of get into at the end. So or whoever, Jeff, I think you're controlling, you can go to the next slide. So the way we integrate health insurance with our clients' payroll accounts is really where our clients choose to have ADP-IA as their broker of record. We are not providing insurance plans that are sponsored by ADP-IA. We work with the local carriers in the states that our clients are based in. Wherever your business location is where we would write the plan out of. Different states have different carriers, different networks, things like that. So in New York, we usually work with United Healthcare or Blue Cross Blue Shield. Texas, I know, also works with United Healthcare. There might be a few others mixed in there. But we provide this as an integration, making ADP your broker of record. We integrate your health insurance plan, whether you have one already or you need us to get a new one set up for you, with the payroll for free. So this is not an additional fee that our clients incur to have the payroll integrated with the health insurance. So if you're someone who doesn't offer health insurance to your employees already, we would start with you from the very beginning. We would get quotes, shop out the different carriers, present different options, and strategize what makes the most sense for your business. From there, we support every single year with the open enrollment. Using our benefits connector, we use something called Ease. This allows the employees to enroll completely digitally. There's no paperwork involved, which is always nice for the back office to not have to deal with, interpreting numbers and letters on a handwritten application. It's all done digitally. They're also able to compare different plans that are being offered and make their selections. As the admin, you're able to track everyone's progress as they're going through the open enrollment to make sure that they're kind of on time for the deadline. And then once your renewal comes up in a year, because group health insurance is based on a 12-month period. So if you sign up for a new plan in April 1st effective date, that plan will renew the following April 1st effective date. When you start your plan, you're locked into that rate for the entire 12 months, and then you're subject to a renewal once the 12 months are over. Typically, everything goes up every year. That's just the way it is. But what we will do at ADP, which not all brokers do, is we shop the entire market for you every single year rather than just giving you the paperwork to re-sign what you already had. That way, you're staying key and making sure you know all the offerings that are out there. That's when you can make changes in a carrier if you're not liking the plans that you've selected. So we provide that entire renewal support. And then something that's really special about ADP Group Health is that you will be assigned to a dedicated relationship manager. If you want to go to the next slide, Jess.
Yeah.
This is a person that you and your employees can reach out to at any time with questions or support, whatever you really need. This is a one-to-one person that you're aligned to. It's not a 1-800 number and you're getting someone different every time. So this person really knows the ins and outs of the business. They know the plans that you've selected. They can walk your employees through open enrollment if you have a new hire. They'll also, you're able to schedule a meeting with them through ADP Run, which is our payroll software. So if an employee needs help, they lost their card or they have a question about a claim, they can call this person directly and not have to bother you, which is a really nice feature. Again, everything I just mentioned is a complimentary service that ADP offers to our clients.
So quick question, Shannon,
yeah.
in terms of before you brought up, Lisa, myself, we're here in New York, but Tiffany is in another state. So the different healthcare providers is that determined by ADP or just the city or state that we're in, or is it a mix?
Great question. It's determined by the city or state that you're in. So when we are getting quotes for group, every state has different ways of quoting a group health insurance group. So for New York specifically, we are what's called community rated, meaning that if you're under 100 employees, your rates are solely based off of the zip code that your business is located in and the usage in that zip code. So it doesn't matter if you have really young and healthy employees, or if you have an older bunch that maybe goes to the doctor a lot more. Both of those businesses are getting the same rates. There's no ability to negotiate at all. That's something that Kayla will speak about in a few minutes. But in terms of the pricing, there's some states, I believe Texas is age banded, meaning your rates are based off of the average usage of everyone between a certain age group. So we would look at how many people are between 20 and 30, 30 and 40. And then their rates are based on the average usage in their age group. So again, no negotiating. It's really just based on your age. ADP does not get special rates from the carriers. So if you use ADP as your broker, if you use a different broker, or if you go straight to the carrier yourself, you're going to get the same price either way, because all we're doing is acting as the middleman, so to speak, between the carrier and the business. We don't have any special deals with any of the carriers, unfortunately, when it comes to group health insurance. But what we do offer to kind of sweeten the deal is all the integration with the payroll and on the admin side of things. So if you are shopping with a broker right now, or you're shopping yourself, say you found plan XYZ and you like that plan, we are able to get the exact same plan for the same exact price for you. So that is that's how it works.
The added value is the value of ADP and that client service person having that advocate or someone inside that when something's not working, or I now lost 3 employees and I want to add someone on, or I want to change the plan completely, that during this year I took this plan just because we needed one, but now throughout the year can we work with that relationship manager to help us find a better plan for the future, kind of thing.
Right.
Okay.
There's also some safeguards in place where you just mentioned, like if you were to lose an employee, when you would go into the payroll system to terminate that employee, they would be automatically terminated from the plan, so that you don't forget to terminate them from the plan and you keep paying for their premium. Or same thing when someone's hired, say you have a 30-day waiting period where you are eligible for benefits 30 days after you're hired. This system, Ease, that I mentioned earlier, will track the eligibility date based on when they were hired in the payroll system. So you don't have to do all that manual tracking on your end either. Any other questions before I move on? Okay, great. Go to the next slide. So ADP does offer and integrate with multiple different types of insurance. So I just wanted to throw this slide in here. We do offer medical, dental, vision, long-term disability, short-term disability, life insurance, prescription. We can get you set up with accident insurance. We can set up cafeteria, Section 125 plan or a POP plan. And then we do integrate with HSAs and FSAs as well.
And these are kind of chosen by the actual insurance. Like if I chose United Healthcare because you brought them up, but I only wanted medical, dental, and vision, but anyone else could kind of opt into some of the other things. Like if it's offered, we can do that. Or am I choosing as the business owner, what everyone will get?
You're choosing what everyone is offered, and then it's up to the employee if they want to join or not join. So they might want to opt out of dental, but take vision. That's allowed. Okay, and we go to the next slide if there are no more questions. So if you don't want to offer group health insurance, say you don't qualify, A lot of states require 2 employees minimum to participate. If you are not at that threshold, or if you don't want to pay for it, or if you're in one of these blue states on this map, these are the states that ADPIA is licensed in, are the red states, and we are not licensed in the blue states, meaning we cannot sell group health insurance to the blue states on this map. We do have another solution that's actually really gaining in popularity called ICHRA, ICHRA. So if you go to the next slide, we work with a company called Take Command. They're our third-party provider, and it's a different health insurance model. So the group plan model that I've been speaking about the whole time, you see on the left here. That means the business is going to offer up to 3 plans with 1 carrier, and all the employees will choose whether they want to participate in one of those 3. The employer will cover a percentage. Sometimes they'll cover 100%. Sometimes the employee is contributing. They can mix and match depending on the state and what's allowed. But their choices are the 3 plans that you as the employer have selected. If you want a different option, meaning everyone can individually go to their state marketplace, so healthcare.gov, and get their own plan that they pick out, you can reimburse your employees through this ICHRA, which is a pre-tax health reimbursement account where the employees are going to upload proof of coverage every single month, and then they will be reimbursed with pre-tax dollars from the business to pay for their individual plan premium. So if you have a lot of employees with vastly different needs, someone might want to pick a really, really expensive plan. Somebody might want just the bare bones basic coverage. With the ICHRA model, everyone can pick and choose, and you say everyone's going to get $500 a month. Take it. You could maybe have that cover your whole plan, or you can use $500 and you pay the excess, but everyone's getting this amount. Use it how you choose. That's kind of the difference between the 2 models. What I see the most common use case for the ICHRA is a company that has 1 employee that wants health insurance and they don't qualify for a group plan, but the business still wants to contribute something towards their health insurance. This is the only legal way to fund an employee's health insurance premium, where it'll appear on their W-2. It is illegal to just increase their salary to cover insurance. You have to have it as a line item on the W-2, which this ICHRA account allows for.
Are there any corporate discounts? Well, not corporate, but business discounts for this model, or are they whatever the marketplace charges are the prices?
Whatever the marketplace charges, so the individual will go out and buy their own insurance, and then the business will contribute whichever amount that they select. So all the different insurance options I'm speaking about, there's no wiggle room on the cost. But what Kayla is about to speak about in a minute here is a workaround when it comes to the pricing.
Okay.
Yep. Any other questions before we move on? Awesome. Okay, I believe that's my last slide.
I have one more question, which is just if you were using the ICHRA, if you were using that, but then, your business does grow and it's not just that you want to use it for yourself, like it's no longer just for me, right? Because if I'm the 1 employee or whoever, do you guys help with that as what, like helping move over from this to the larger plan once you have the 2, 3, 4, 5, 500 people suddenly?
Yeah. Great question. 500 people suddenly would be.
Well, no, well, I work with a lot of small businesses that are,
I know what you're saying.
Funds, and then there's that quick growth and not prepared, right? So they were paying in to cover, right? But now, is that an easy shift, or do you still have to wait in that 12-month cycle too? That was
good question. So just a disclaimer, you cannot participate in this ICHRA if you're the owner only. I should have mentioned that before, so thank you for bringing that up. This would only be eligible for an employee to be reimbursed through the ICHRA. So yes, we would then transition you from the individual plans to a group plan. It would be a qualifying event for the business to set up a new group plan. It doesn't, everyone would just be able to cancel their individual coverage and move over to the group plan, which we would help with through the group plan model that I explained before, with getting quotes, getting it integrated, the relationship manager, all of those things. All right. Think anyone else have a question? Awesome. Well, thanks for all your time and attention. If any other questions come up throughout that I can help answer, I'll be here, but time for Kayla to go.
Okay, awesome. Thank you guys so much again for being here. We really appreciate it. So for the next 10, 15 minutes, we are going to talk about the PEO, or professional employer organization, space and concept, and the trends that we're kind of seeing in the market. Again, PEO, the industry as a whole, right? What the company is and what's included in this model. And then what are some triggers or signals that a company is a good fit for this model? We can go to the next slide. Okay. So this is basically what we call a traditional employer model. The owner essentially sits in the center of the business, right? They're managing multiple vendors, payroll, tax, benefits, and everything in between. So information is basically moved between silos. So data is in, data is out. What happens to the compliance piece of the data going in and out of the business? Alongside that, obviously, right, as a business owner, you are exposed to a lot more liability, which is then very labor intensive and ultimately diverts you from resources surrounding your core activities, like generating revenue, increasing headcount, expanding into multi-states, so on and so forth. I think if you click this, the slide should move a little bit, Jess. Okay, this is what the PEO model looks like. So as you can basically see, right, the owner is going to share certain advantages and resources through the model. This is done through co-employment. So think two partners, right? In the PEO, the business is sharing liability, but they're also leveraging ADP's federal ID number to pay their employees. So it's more, think of it as less of a vendor and kind of more of a trusted partner. And that trusted partner, right, is ADP. And we are sharing risks of being an employer with that company. So by joining a PEO, compared to the last line we kind of just reviewed together, right, you're not only consolidating vendors, but you're streamlining all of your processes. You're now also integrating systems and you're mitigating risk. So business owners could then go ahead and focus on what we call their human capital management, or their people strategy, optimizing productivity, gaining a competitive edge. And then ADP, right, does what we're best in business for, right? Everything streamlined through people and technology to connect you guys, of course, to the best resources and insights that are available as being a client of ADP Total Source. So I have been doing this now for about 9 years. When I first started, there really was not a lot of PEOs in the space. It was, maybe there were 3 big guys kind of in the market, and those were your options. Now PEO, especially in, the larger metropolitan areas, this concept has become more of a commodity, right? Everybody is on a PEO. Everybody is looking to gain access to a PEO. And it's really important to note that not all PEOs are kind of equal. And I'll kind of go through what to look for in a potential PEO partner in the following slides. So when analyzing a PEO, I would say these are kind of the top 5 things you want to look at, right? Financial stability. Are they certified by the IRS? What do they offer? Is there anything that is being carved out or not offered, like benefits, like comp? Are they managing SUI? What is the experience from a service and renewal perspective look like with that PEO? and what are the services that you're being offered and what are you paying for. So the following slides kind of just take a little bit of a deeper dive into it. But as you can kind of see on this slide, right? And this is kind of thick in content, but not all PEOs are the same. So on here is basically like the bare minimum of essentially what a PEO should be offering to a client. It's end-to-end human capital management. They're helping you manage your people from the second they receive that offer letter, everything in between, and then of course to retirement and or termination, everything in between. On the left-hand side, you can kind of see what a standard benefit offering looks like, right? I mean, I speak to so many business owners every single week, and they think that they're doing great by simply offering their people medical insurance. That's awesome, right? You're doing a great job by even offering healthcare, but more often than not, especially in markets as large as Texas or as New York, everyone's offering medical. Your people want much more than that, and they want better. And if you don't offer that to them, right, they're going to leave for a competitor that potentially is. So on the right-hand side is what better can look like. And all of these benefits, whether they're hard or ancillary benefits, are included in ADP's total source offering. This is not simply across the space. I'm speaking specifically to ADP total source. Obviously, the best-in-class PEOs are going to offer what better looks like, as you can see on the slide here. Benefit administration is really important. So this is a really big focus for obviously a lot of PEOs. Bare bones are going to include support with open enrollment, maybe new hire enrollment, and basic data entry. But comprehensive benefits admin is going to be like a consultative benefit selection process with a dedicated person. Video communications, employees have access to what we call the My Life advisors. Obviously, everything is going to be done online through their cell phone or by calling in. And then, of course, healthcare reform data capture, COBRA administration, and everything in between. It's all handled through the PEO model. So payroll and tax filings. Standard PEO offering, of course, is going to include payroll processing, right? Wage garnishments, time and attendance, preparation and filing, W-2s, like the basic of when you think of a payroll company, the bare bones of what they should be doing. A more comprehensive offering and what ADP Total Source is going to offer and include in the administrative fee that you pay is going to be on the right-hand side. And it's kind of just an elevated version, right, of payroll and taxes. Workers' comp and risk management. It definitely is an important area, no matter the business you're in. But obviously, the more blue collar or riskier business, right, the more this really truly applies, and you need and want a best in class partner to handle this line item of your P&L for you, so that everything is accurate. You're mitigating risk, and you're truly streamlining the area of workers' compensation. So great, ADP can do COBRA, they can do EPLI, safety awareness training. This is what all businesses honestly should have in place or should be doing with or without a PEO. These are kind of like basic business practices, procedures.
Yeah. I was going to say, does this partner with the idea that you guys also work on the employee handbooks and all of that, so that that can reflect each other, which is something that other providers don't have, right? So if I say I'm going to provide this, then you guys can also make sure that I live up to what we put in the handbook or my handbook. Okay.
Yep. And honestly, like, you'd be surprised. There's so many businesses that don't have a handbook or have a handbook, but it hasn't been updated since 2000. That's kind of like the first stop for us when we onboard a client. We are asking for your handbook if you have one. We have a handbook builder in the technology and an actual compliance team that will review the handbook as much or as little as you'd like to ensure you're in compliance on a state and federal level. And then, of course, again, on the right, from a workers' comp perspective, this is truly what better is going to look like when it comes to, obviously, service, workers' comp, and risk management under ADP's PEO. HR technology. this is kind of, where that HR handbook builder will essentially come into place. But these are kind of the basics of HR, right? Onboarding, benefits, payroll, so on and so forth. What better is going to look like, right, is built-in compliance checks, integration across apps, API development capabilities, AI-infused tech, so on and so forth. And this is, where ADP can really step in and make your business better. This, again, just to kind of piggyback on the HR admin side, this is the support piece. So a really important thing that I'd like to point out with ADP Total Source, no matter the size of your business, you could be as small as 2 employees, you could have 200 people. You are given access to a true dedicated team, and the quarterback of that team is a dedicated HR business partner. So a lot of other PEOs out there do not give their clients access to real people. You have a chat feature or a chat bot or a 1-800 number. A lot of PEOs actually did away with dedicated service upon COVID when everyone kind of had to run lean and mean to keep their business afloat. Thankfully, right, ADP did not have to do that. We are the largest PEO for a reason, and we invested in our people to then cater to our clients. So you do truly get access to a real person to support you from a strategic and administrative side of HR. And then talent, right? There's our handbook piece. Those are kind of bare bones, right? Handbook, job descriptions. Maybe you're doing background checks and screenings, maybe you're not. But here's kind of what better can look like, right? Performance reviews, compensation management. How engaged are your people? Do we have leadership development opportunities for them? Are they falling flat? Do they need and want more? If so, what do they want? And again, that dedicated HR business partner, along with ADP's data and analytics, can support you and kind of bring your business to that next level. And then right into kind of the business insights and analytics. So again, a comprehensive approach is going to look like what's on the right-hand side. And just, ADP, we pay about 1 in 5 Americans. So this data, these analytics that we give to you guys as clients of ADP is real time. And it is aggregated data, of course, but it is pulled from all of our clients. And by the way, on this PEO model alone, I'm not even speaking about how many Americans we pay. We've got almost 750,000 worksite employees sitting on ADP's federal ID number on the PEO, and over 25,000 clients. That's a lot of clients, right? The market share that ADP has in this space is through the roof compared to our competitors, and rightfully so, right? And I think that might be our last slide. I don't know, Walker or Jody, who would like to kind of wrap us up here. But before I hand it off to them, I know that was a mouthful, and I know I went through a lot of information around the PEO. Are there any questions or concerns or comments you guys would like to make?
Oh, there's questions.
Okay.
Lisa had some questions. They're in the chat.
I'm happy to read if it's easier.
Yes.
I was taking notes as I was listening. So this was like I said, it's a little out of the scope. This is about an individual plan that I recently got this past year. It's a PPO plan through PHCS. They call it a value-based plan. It's got like a $750 deductible. I got it through a broker. And then I became an employee through this company called LifeX. And I really don't get paid for work other than occasional surveys, things like that for them. This became, as an individual, more of an option for me, compared to Cobra and the marketplace plans I had looked at. So really the two questions I was just kind of to get input on are, are there any considerations or potential concerns with this type of plan structure? And then I know that given the ADP payroll setup, would it be possible to access or enroll in a dental benefits program ahead as an individual through ADP?
So I can take that one. That type of plan structure I'd have to look into a bit further, a value-based plan. I'm not familiar off the top of my head, but hearing the name of it, it seems like it might be more of like a catastrophic type coverage almost, where it's more things like hospital visits, like major operations are covered. Is that what it
It's actually it's a step above that. They did mention that to me as like a bare, like really. Like
Okay.
this is more of the limitations like 10 you get 10 regular doctor visits not
Yeah.
including your wellness checks, and then it does and then you get to go through the network, it's a nationwide network, and look for the thing I'm having a hard time is finding
Mhm.
doctors being taking the insurance. I think my one doctor does, but then he left the practice, and now I'm like searching again, right? So
Yeah.
that's so thank God I'm not gonna I'm a pretty healthy person, but like I thought you mentioned that the I just thought if it's helpful for the group, I don't know. I don't want to take up all the time here. So,
No, that's a good question. Definitely Cobra can be very expensive. So no, there's nothing, you can't, just because you're paid through ADP, you don't have access to like the plans Kayla was discussing. You would need to be joining the LifeX plan. Um, and that would only be if they offered it to part-timers, which sounds like you maybe are, or 1099, which 1099s are not eligible for group health insurance. So unfortunately, and the common phrase I use when talking about health insurance, they don't make it easy for individuals at all. There's really nothing available other than a marketplace plan for you.
Yeah. No, there's always that too. Like, the names of things, it's like mattresses. They're the same mattress in 40 different, places, right? Sealy, so and so, such and such. But they name them differently. So it appears to offer more. But yes, there is always that struggle in between. Also, if you're in between jobs, working at one employer to another, or becoming the employer, right? And then having to figure out what to do and when to move someone over. And that's why I asked earlier about, like, how do you pick and choose? And then there are all the, I'll call them, I don't, and I would love to know if there's an actual, name term for it, but when they aggregate larger groups of entrepreneurs and, over with under an umbrella, where you can potentially find better pricing as an individual um, employee and still give into your own plan. So that's why I was trying to figure out, like, at what point is it more cost effective to
Mhm.
do I can't even pronounce it now, the ICRA.
ICRA, yeah.
Okay.
Yeah.
Or, because the shopping also takes a long time. And I would agree, even with, I was going to ask with your plans, not just what Lisa's going through individually, but as an employer, if you're choosing certain plans that don't give as much value or have as much cost, they tend to also have less doctors in those networks. So is that some of the stuff that you also do some research on if we were using you? Because
Yeah.
that becomes the struggle bus. Like, I love my OBGYN since it's
Right.
sister, right? But she's not with this plan I'm on. And then I'm still coming out because I don't want to, like, there's certain things that maybe you don't want to change, right? I love my dentist or whoever.
Yeah.
Like, so now I know what that costs for me for a dentist cleaning and for him to check my teeth. I know it's $325, right? So to me, instead of, so people are also choosing that. So where's the tipping point of choosing to do like an ICRA or trying to do something else too, is add on to what Lisa's asking too.
So the group health insurance plans typically have a lot more doctors in network than the individual marketplace plans, like what Lisa is sort of on now. That's why group health and getting insurance through a business is like the Cadillac, whereas going through the state is option B. That's why businesses are encouraged to offer health insurance to their employees. You're actually not supposed to be on an individual plan if you are offered a group health plan through a company. All folds into the overarching umbrella term of the healthcare crisis, right? It's not cheap. It's difficult to understand. And there's so many nuances that make some things null and void for some people. Some people don't want to lose their doctor, so they choose to just pay out of pocket. The main thing I would say is with ADP, we are really focused on business provided health insurance. So the only time we're touching an individual policy is through the ICRA, which has to still be tied to a business. Other than that, I feel like solo entrepreneurs are in the worst spot when it comes to health insurance options, just because it's just you, and the government doesn't want individuals using a business, right? Anybody can make up an LLC and then go get health insurance. That's not allowed. That's why there's the 2-employee rule when it comes to who can actually join a group plan. So not saying the solutions are perfect or necessarily giving the answers that you would have hoped to hear, but that's just the hand we're dealt. So our role here is to make it as easy as possible for a business to provide insurance to their employees.
Gotcha.
One other thing is I wanted Kayla just to jump in and just give a quick overview of what it looks like to come out of the community rated pool in New York on a PEO model. And again, like she touched on, I feel like sometimes you hear PEO and you think you have to have 40 or 50 employees, and that's not always the case. So just wanted to pass it over to you to kind of touch on that.
Yeah.
Great.
So specifically in the state of New York is what we call a community rated healthcare state. So when you are a business offering healthcare to your employees and you have less than 100 people enrolled in the plan, you are subject to the rates and the plans that are essentially dictated by the state of New York. There's no negotiating the plan. There's no negotiating the premium. The three of us, me, Shannon, Walker, if we are all at the same company, we all have access to the same plans and our premiums are the same, right? With ADP Total Source, we're taking you out of that small group because, like I mentioned earlier, this solution has over 750 other people on it, right? And we are going to the carriers directly and we're negotiating, hopefully, not only richer plan designs, but more affordable healthcare premiums that the employer, of course, can then offer to their employees.
Another workaround that we see sometimes is in New York, for example. New York is a non-contributory state, meaning the employer is not required to contribute on group health insurance. The employer is not required to contribute any specific amount. So you can contribute 0%. If you're in a situation where you are like an individual entrepreneur, you're getting health insurance through the marketplace, some people choose to hire an employee and offer a lower level plan to that employee and cover whatever is needed for the employee to join it, just so that they can also get a group health insurance plan. Because when you have one employee on the plan, the owner can join. So that's something that we see a lot of, actually, especially in New York.
That's what I figured would happen too. Like, and also if you decide, like me, I've gone in and out of being an employee and then really making my business the focus. And when it was growing, these type of opportunities for insurance or insuring I actually had employees at the time, was much more difficult than for me to make that shift because I didn't have someone to particularly help me. And it just seemed confusing. So I was just like, I'm sorry, I'm just going to have to keep you as a 1099 because I know how this, like, sometimes you, just like in any other part of your life, you do the things that you know until you just really can't, or you finally find that help. And I'm hoping that those of you who are on the call today are also able to do that, right? Like, in other words, that's why I'm doing these and partnered with ADP so that you can get some information. You might not be ready now, but better to be prepared for something like this, or to make that shift, or to start working on the other parts of your business that you can, so that you're ready when this is ready. Because often that's the other problem with at least entrepreneurs, small business owners, it's like you're dealing with so much stuff day to day that you do forget about the handbook and you do forget about doing a training or, really working in this space of insurance, which is really an animal, no matter which city or state you're in. So that's why I thought this was really important to kind of kick off in the beginning of the year for people to think about it, even if not yet in this space, but to get some questions answered. And I know a lot of folks don't know PEO as a term, and definitely the ICRA and all of that. I didn't even know it really had a name. I just kind of knew it existed until today. But I definitely have made referrals for folks to try to get this information, whether or not, and you have been really great at this.
Well, thank you again. And this is our information below. If you need to reach out to any of us, have any additional questions, because I know this was a lot of information at one time and kind of takes a minute to process all of it. So feel free to reach out. Jody also has our information. And yeah, just looking forward to continuing this partnership together and providing that support to anyone who has questions or needs our help.
Right. And even if it's not you and you know someone else who's making these shifts or this is something that they're struggling with, please make the referral because at least they can get their questions answered in a time and space that could work for them, you know.
Definitely.
And with people that we clearly now know a lot more than we know, or at least more than me. I don't know about you guys. So which is why I brought them along. But I do want to thank everyone for coming out for your lunch hour. We're giving you 9 minutes back since we didn't use the whole hour. Go get that makeup put on right, or go get that extra coffee you think you need, or maybe just some sparkling water. And as my cup says, be amazing or continue to be amazing today. And just know that ADP is here to assist you in so many things. Like just go to their website. There's so many things I didn't know till speaking with Walker and then doing my own research as to why partner with ADP over some other companies and other places. But it's the long game that they've been in. They've definitely evolved over time and have added a lot more value in this space, and especially to small businesses and those who are independent, to kind of make sure you can stay in the game and get some of the better services as well as products. So I just want to thank you guys, Kayla, Shannon, for sharing your knowledge from the top of your head, even though you had slides there. I know you know this with your eyes closed, and Walker for putting together this great team. We hope to see you again. We'll be doing another one next quarter on another topic. We haven't decided. So you guys who are here with us today, please send me and or them some ideas. You have their information as well that we can decide what we're going to talk about next, and make sure that you are on the cutting edge and in front of the curve instead of behind it on the things that you need for your businesses to run the way you see them and envision and had hoped, a few years back, and now you're in it. So we want it to look like what you want it to be. So thank you guys so much and have a great rest of your afternoon.
Thank you. Have a good
Thank you,
one.
Jody.
Bye bye.